Hello and happy Friday. Thank you for joining us on this Friday before a long weekend. I hope everybody has some fun plans or plans to relax or whatever plans that you may have. Or if you're not celebrating at all, I hope you get whatever you'd like out of this weekend. But yeah, welcome to our AOT community of practice. Thank you all so much for coming. If you received our email reminder, you know that today we have Stephanie Swisher and Stacey Batzer here from Washtenaw Community CMH to talk about their AOT program and give us all kind of an opportunity to ask them questions and share your own experiences. And as always, there'll be a Q&A portion at the end, so feel free to raise your hand during the discussion, put it in the chat, or save it to the end, whatever you'd like to do. But before we start our chat with the wonderful Washtenaw team, I'm going to go ahead and plug the opportunities that we have and the new things that we've added to the toolkit. So for those of you who come every month, apologies for hearing this for the billionth time. But for those of you who may be new, I wanted to share the opportunity we have where twice a month we have Dr. Scott Smith available for drop-in AOT Q&A sessions. So anyone can come to these sessions with any AOT related question. This is a great resource to share with families and natural supports of AOT consumers, as well as other professionals that you work with that may have questions that you yourself can't answer or don't want to answer. But as AOT gets more attention across the state, more questions are going to arise, so please share this information internally and with community partners you may work with. So to help with that, we are going to go ahead and drop the Q&A flyer that we've made in the chat. So feel free to share that amongst your network. That would be really helpful. So for next month, June 9th is our next Q&A session from 11 to 12, as well as the next one is Wednesday, June 18th from 2 to 3 p.m. We're going to go ahead and drop that information in the chat as well for you. So yeah. The next thing that we want to talk about is our AOT Toolkit. I know most of you are aware of the toolkit and have visited it in the past, but we're constantly adding new things and resources that we've developed. So we develop those with our experts and community partners and viewers like you. So I wanted to take this opportunity to show you some things that we've added. So I will go ahead and share my screen. Okay, wonderful. So first we have the AOT Mental Health Code Guide. So this resource was created to help individuals, families, providers, and advocates better understand the Michigan's mental health code as it relates to AOT. So it pairs legal language with plain language explanations to clarify rights and responsibilities and court-ordered mental health procedures. There's also a glossary of terms. It's included to explain important legal and clinical concepts in everyday language. So this guide aims to make the law more accessible, but it's not a substitute for legal advice. As you can see, we have some quick links here. If you scroll down, if you're looking for something specific, we have some quick links here, as well as the ability to download and print this complete guide. So if this seems like it would be helpful for you or anyone you know, go ahead and check it out. And so the next one we have is understanding the AOT deferral process. So this guide is specifically for individuals on AOTs and their support systems. It's to help them understand the deferral process. So as a lot of you may know, the deferral allows someone to voluntarily follow a treatment plan with the support from their care team and oversight from the court without a formal court order. So the document explains key timelines, participant responsibilities, rights, and what to do if challenges arise. So we have been focusing lately on developing more materials for individuals, natural supports, and we want to make sure that you're aware of this resource if this, looks like something that would be helpful to share out. So that being said, those are two of the resources that we've added in the last month, and you can always find past COPs, past community of practice recordings on the toolkit as well. So be sure to check out the toolkit regularly for new items. And if you have any ideas or feedback or something that you see in your line of work and in your job that would, you think that would be a great thing to have on the toolkit as a resource for everyone who works for AOT, definitely reach out to us with that idea. Because if you have the idea, we have the time, we'll develop it. That's our job and we love it. So yeah, we love feedback too. So feel free to always reach out with that kind of stuff. So without further ado, we'll go ahead and jump right in with our conversation with Stephanie and Stacey. I'll go ahead and ask Stephanie and Stacey to briefly introduce themselves. So, so Stephanie, why don't you go first? You just do a brief introduction.
Okay. Hi, I'm Stephanie Swisher. I am a supervisor with Washtenaw County CMH. I've been working there in some capacity since 1994. I started in our DD services program. I moved to Adult MI, which is where I kind of came into contact with the consumer that started Kevin's Law to begin with. And then I've moved on to do supervision after working at ACT in the jail, at our satellite offices. So I've kind of got a little bit of everything.
Wonderful. Thank you so much. And Stacey, go ahead. Oh, you're on mute, Stacey.
That'd be helpful. So I'm Stacey. I've been with the county for just over 9 years. I started in Adult MI as a case manager for about 4.5 years. And then I moved over to doing intakes for our CARES team. It's kind of the mild to moderate caseload group that we've got. And then in 2023, I believe, at the 2022, at the beginning 2022, I moved over to the general intakes from 22 to last year, January, when I took over as the court liaison. And previous to that, I worked at COPE with Stephanie, who told me to apply at the county. So I work here because of Stephanie.
And we came full circle years later as she now works directly for me.
Right.
Wonderful. Well, thank you both so much for being here and working with y'all more directly in the last 9 to 10 months. I've seen the amazing work that you and your team have been doing and all the barriers that you've been able to navigate, probably like so many people in this space right now. So I'm really excited for us to dive in and to talk about the amazing work that you've been doing and for others to share their experience as well. So first off, I know you mentioned this a little bit, Stephanie, but I'm not sure if everyone's familiar with your specific history with AOT and Kevin's Law. So do you mind sharing a little bit about that story?
Sure. When I first started in case management, it was around 1997 with our Adult MI team. And at that time, I did general case management for Adult MI. And then I moved into a program that we had called Meds Plus. And this program was designed for people who worked or went to school or just generally needed like an evening clinic hour kind of thing once a week. They had different standards, such as you need to see a doctor at least quarterly. We would give prescriptions longer, that sort of thing. So it was just a kind of clinic, more of a clinic model for people. At that time, when I took over the Meds Plus case list, there was about 125 people on it. And so my first responsibility was to go through and kind of case review everybody to make sure that they were at the appropriate level of care. And it just happened that Brian Williams, who's the young man who is responsible for Kevin's Law, was one of the clients that was on my caseload. At that time, when I did the case study, I realized that he needed a higher level of care. And I pretty much immediately moved him off my case list and to the higher level of care. Somewhere between 1998-ish and 2000, he disengaged in services with us. At that time, as everybody knows, all you had to do was be 18, your own guardian, and not currently a threat to yourself or others. And you could do pretty much anything you wanted when it came to the mental health realm. And so he disengaged in services. And at the time, we didn't have a concern of safety. I'm not sure what we could have done at that point, but when he disengaged, he was okay, it seemed. 6 months later, he was having command hallucinations after several interfaces with police, with other providers who were unable as well to do anything for him because petitions would only get you so far back then. And it was very, very subjective to who was going to be working with you on that petition. The police may not get involved, they may not take them. And it's my understanding that throughout that process, he didn't end up at an ER, he ended up in jails most of the time. So he never really got mental health help at that point. He was having command hallucinations when he was on the bus back to Kalamazoo, where Kevin was on the bus too. And that's when he attacked him and beat him to death in the bathroom at the Kalamazoo station. So after that, you know, our agency was sued. There was a huge lawsuit. There was a bunch of things that happened. And subsequently, in 2005, AOTs became a real thing. But yeah, so that's kind of our connection. Washtenaw County has an intimate connection with AOTs.
Thank you. Thank you for sharing that. I think it's so important to recognize how far we've come in these laws and the processes. And yeah, I appreciate you sharing that. I was wondering if I can ask specifically about your program, how many folks you have on orders and deferrals. And I'm also wondering, you know, if that has significantly changed in the last couple of years or even just in the last year. Because I have talked to, you know, a lot of CMHs where, you know, they've seen a spike in the AOTs that they've been receiving, and also some folks where it's stayed pretty consistent. So yeah, what's been your experience?
Stacey, you want to take this?
I've got all the numbers. I just looked up the Washtenaw County population is as of 2023 is 365,000 people. And right now, as of May, we have 383 clients in an AOT, as compared with August 2023, which is the earliest that I have because that's when I started training. And at that point, there were 290. So we've gone from 290 to 383 in the course of, you know, a year and a half. And of the 536 thousand people, that is 0.1% of people of the population. And then I broke it down a little further if you want more numbers. The people on the full 91-year orders, out of that 383 is 197. The 6180s, we've got 150. The 90-day, we've got 15. Initial 180 is 17, and then we've got this weird funky 60-90 that the judge decided to do, and 2 on other, whatever that is, like new orders. So that's kind of where the breakdown is. The majority of people are on the full orders, followed by the 6180. That makes up a lot of the population though. And then as far as the age of being put on an order, the majority are in their 30s, which kind of surprised me, followed by 20s and 40s kind of equally. So, and then spreads out from there. But people in their 30s, 125 of them are put on an order in their 30s. That's a lot of numbers.
Interesting. Yeah, that's an interesting data point. I'm curious if that is an experience with the age range, you know, if that's an experience that or an observation that other counties observe as well. But
well, I think it makes sense because a lot of the consumers that we find getting on orders are usually the younger folks who are just having first breaks and really trying to get them to buy into understand where they're at with their first break and or what's going on in general. You know, a lot of these people are new adults, they're on their own, the stress is high, so it seems to be right on point.
yeah.
And doing the intakes, I did see a giant increase of people coming in who were heavy smokers of marijuana having psychotic breaks. That was definitely a thing that had popped up over the course of the 4 years.
Interesting. So thank you for pulling that information. I think that's really valuable because in this space especially, we have different CMHs who have vastly different, you know, folks on orders and deferrals. So it's good just to get a little idea of how many, you know, folks you're working with. So, and I know this can look different in each county. So can you describe what your AOT team looks like, how it's structured, who's your dedicated AOT staff and what are their responsibilities and what does your workflow look like?
Yeah.
I guess that is me. So it is, I am the person that does all of the AOT process. And then I work with the psychiatrist, Dr. Healy, 3 days a week. And Stephanie's a supervisor, obviously, and Stacey Shaw, we've got as our prosecutor working with us. But breaking it down through the week, I would be interested to hear how other people manage this. But as far as Monday through Friday in general, Mondays and Fridays I work from home. And that's the time that I generally do a bulk of the petitions, and I'm getting the notices ready, looking up those numbers in Odyssey, all that good stuff. And then doing the scheduling. So during the scheduling, I try my best to leave folks 3 chances before their order expires so that they have enough warning. And then on that last opportunity, I'm emailing the case managers and warning them it's your last chance and it's going to be lost. And as far as our psychiatrist there, he's retired, so he kind of came back to help us out with the AOT program, and he works the Tuesday, Wednesday, Thursday that we are in office serving folks and kind of doing that process. But he can only work up to 1,000 hours a year, and we have no backup. So it is me and Dr. Healy. We are in it together. And then the Tuesday, Wednesday, and Thursday is when we go into the office and I meet with people. We've got 2 different locations, one in Ypsi, one in Ann Arbor. I spend Tuesday and Wednesday in Ypsi and then Thursday in Ann Arbor. Wednesday morning is spent going to court. Thankfully, it's virtually. And then back up to Friday where I'm doing all of that prep work and getting ready. And then on Thursday afternoons, I'm submitting that request for the notices from probate. And hopefully they get back with me on Friday and hopefully they have the right lawyer because that's been an issue lately. But yeah, I mean, as you know, when there's no shows, you gotta fit it in the next week. And because our psychiatrists can only work 1,000 hours, it can get difficult, we'll say.
Mhm.
And then kind of on the side, I'm doing pickup orders and modifications as they come up. And then in that rare chance, which happened lately, there was a jury trial. And thankfully, it was the first one that I've had, since doing this position. And not a big fan.
Yeah. And piggyback off on what she's saying, as part of the other side of the department, we have our hospital and court liaisons. And so they also process paperwork for AOTs, but they're coming from the hospital. Stacey is doing our work primarily for continuing reviews throughout the agency after they get put on the orders. And at the point of entry is my court and hospital liaisons. And so they're doing the ATRs and the proposed orders for the court, going to deferral meetings, that sort of thing. I pulled a little data on how many things have come through our mental health court for probate for us because we handle any probate matters. Minus the VA, which in the past we've done the VA, but we've kind of put our foot down and said, we're not doing the VA anymore. You guys have your own people. We do stuff for the jail. Stacey's usually responsible for anything that comes through our jail. And we do not do CFP or Walter Reuther. We have a state hospital liaison that does that. She was working on our team until about 4 years ago, and they moved her because she's more intimately involved with the residential team because of NGRI, things like that, and placement issues. And so they thought that would be a better fit. So from about mid-October of last year until to date, we've had 327 orders come through that we've been involved in some capacity. We have roughly 33 hospitals that we follow, hospital systems. Some staff have more than others, while each of them have roughly 11. Some of the systems may have multiple hospitals, so they actually have more. So it really just varies. But out of 20, this number was 327 out of 23 of the 33 hospitals we have. And that's just whatever it comes through, we're responsible for processing it.
Wonderful. Wonderful. Thank you so much for explaining all that. I can say I love to hear the relationship between your psychiatrist and you. I know like a lot of folks in this room would be, are probably very marvel at that kind of relationship and time, even though you have to navigate that 1,000 hours a year, psychiatrist availability can be a huge barrier in a lot of different counties. So yeah, lots to navigate there, but I'm happy to hear about that. And
We are
it looks like,
besties.
yeah, I love that. Yes. I mean, to come out of retirement to help with AOT, like, who are you? An angel? Oh my goodness.
He did our
Um,
AOTs for a long time, and he actually was our ACT doctor for many, many years. He actually is, I have to be honest, out of all the psychiatrists I've worked with, he's fantastic when it comes to the way he handles the consumers in this capacity. I think you really have to be able to work with the client where they're at, because people don't want to be on orders, so those appointments can get pretty unpleasant, but he always manages to get them through it with grace. He's pretty amazing.
that's wonderful. And that's amazing to hear. Just to address some questions I have in the chat, can you explain what Odyssey is for us?
Oh,
Odyssey is
sorry.
our court system. Yeah, that's the system,
Oh,
probate court system that we use. That's our access is Odyssey.
okay. Wonderful. And then
Sorry,
can
I
you,
wasn't looking at the chat.
no, that's okay. That's okay. That's my job. I can do that. Yeah, you can just share your expertise with us. So can you explain, also another question in the chat, can you explain your experience doing the jury trial?
Oh, okay. This just happened last week. So it was my very first one. And, obviously you go through all the steps of I want a jury trial, pre-trial, all of these things. And when I showed up, I really didn't know what to expect, because from what I had understood is that it was pretty rare for them to pull the petitioner into court. So I didn't know what to expect, and I was super nervous, and I'd never been on the stand before, and I was not expecting our judge. I didn't realize that the burden of proof was on me as the petitioner. And the way that she put it out was, if you don't believe her, if you don't feel that this petition is, up to snuff or whatever. And I'm looking around going, I'm not a lawyer. Like, I didn't know what to say. They pulled me up onto the stand, and I was kind of surprised. I mean, I was warned, like, hey, what your job is to explain to the jury in layman terms what is the process, what is AOT process, because nobody understands it. And I was like, okay, so it's kind of like this, like they're asking me questions, but still the counter argument and all of that, I had no idea what I was going to be asked. And luckily, we had a judge that was very friendly and nodded at me, because I think she could tell I was like going to pass out. But so that was the process. And then we went for lunch and we came back, and Dr. Healy did his testimony. And at the point that they were going into deliberations, I got to leave. So yeah, and we won the case. But yeah, there was a lot of, if you don't believe what she said on the petition, this is the burden of proof. And I'm thinking, I have 3 lines. Like, it was nerve-wracking, but it got through it.
Thank you so much, Stacey, for sharing that experience. I'm sure, like you said, it was very difficult and kind of anxiety ridden being put up on the stand. Unfortunately, Olivia, Zoom kicked her out, so I'll go ahead and take over for her until she returns. But yes, thank you so much, Stacey. And so I'll go ahead and move on to the next question if anyone doesn't have any questions pertaining to what Stacey just said. Okay, thank you so much. And again, I'm not sure if this is directly towards you, Stacey, but one of the biggest variables and components of how we do this work is our relationship with law enforcement, the hospitals we partner with, and the probate court. So do you mind telling us a little bit about your relationship with each of these systems and how they may have developed over time?
Well, I can speak to the relationship with the court, and then I'm sure Stephanie can speak to the other relationships. As far as kind of what I do with on a personal basis in dealing with the courts is, we find that there's a lot of disconnect between us and our judge, because we can't seem to get through to her to discuss things that go on. And, for example, there's been a lot of kind of inconsistencies that the judge that we work with primarily tends to go with the lawyer. We work with like 5 different lawyers, I believe, and they cycle every week. And it started to be this process of whatever that lawyer wanted to, pick on that week became like, oh, okay, well, we're going to throw out a petition for that reason. And then the next week it would be another reason. And the next week, so it was just constantly trying to keep up. And I mean, they weren't wrong in the things that they were pointing out. It was just that we had no warning. We had no, we didn't know that it was coming, and it wasn't anything that had been an issue for the prior 7 years for the person that had been doing the job. And I'm not really sure why that was. Stephanie kind of speculated that maybe it was because coming out of COVID, they were finally kind of pushing back and going back to the old way of doing things. And some of those things that they were previously, kind of letting go is that we could serve people without seeing them when they didn't show up and they were on a continuing order. We could kind of virtually serve them and have the case manager serve them, or I could mail them, or and then they would kind of let that go through. Yes, they understand the process. Yes, they've been through this a million times, and kind of go ahead. Another one was the mailing length that, had to be 14 days. It's like that had never been an issue. I didn't know that that was an issue until it was an issue, and, now I know. Now I've got the mental health code memorized. But another thing was signing the proof of service is that, when the case managers would hand the paperwork to the client, I would sign off saying, yep, I attest to it. I watched them do it. And then they came back and said, nope, it has to be the person who physically handed it to them. Because another thing that we were doing is presenting it over Zoom. We put it in the chat, and then we walk through the paperwork with them and say, yep, you received it. I can attest to that. We watched it, right? And that was thrown out. We had, I think, 6 the one day that I was called to the stand a million times over and over and over, and just grilled. And that was an interesting day. And sometimes we'll have the lawyers not turning in the stipulation paperwork. So, nothing is signed. The signed order isn't put in. So, when I'm, saying, oh, okay, this was a stipulation, sometimes they will backdate the order, but it won't always be the date of the court hearing. So it creates these inconsistencies in our system, or we don't know what's going on because they're not put in there. We kind of lack checks and balances when I'm turning in the paperwork, because that lack of stipulation, it's not in there. And there's no way for me to like log into Odyssey and check it because it's just blank. So I don't know, is it a stip? Is it an adjournment? Is it, what went on with it? And week after week, it's that kind of kind of back and forth that we've dealt with. Yeah, so that's kind of our process with the court that we try to work with, but without that direct contact with the judge to kind of get a baseline. This is what's expected. It's been a process, trying to figure out what do they expect week after week. And we've had countless petitions thrown out, countless. And we don't see it coming. So now our new process, which has been working pretty well in order to get past this person was served physically, is that I don't turn in the paperwork until whoever gave that paperwork to the person gets that proof of service back to me. And I make it very clear that if you do not turn this in, if you do not get this back to me by Friday, I can't turn in the paperwork, and therefore you have to start the process over, which is very inconvenient for the client. So far, kind of playing hardball. It's been successful, thankfully. And then Stephanie knows about the hospitals and law enforcement.
It's hard to say. Every hospital is different, and we have, like I said, so many that we follow. We obviously have a better relationship with our in-county hospitals, because prior to COVID, one of the requirements for the liaisons was that if there was a deferral meeting, they had to go to the hospital with the lawyer to complete the deferrals in person, as well as on Wednesdays as our court day, Wednesday mornings, they were required to be in court every Wednesday in person. That changed with COVID and with the court systems. You know, some of the judges in Washtenaw County, I can't speak for other places, but for Washtenaw, some of the judges found the convenience really great, and they wanted to continue it for not only themselves, but for the consumers, because it was easier on them to be able to get to court, transportation, other issues, homelessness, all kinds of issues. But people have cell phones, so you can get your cell phone to work to get you to a court hearing. I think, speaking back to Stacey and her first starting and the changes with the court and all of that, at the same time Stacey started and our old liaison left, there was also a new court clerk who had very little experience. And so I think that played a lot into a lot of our confusion, or their confusion. He truly did not understand what the continuing orders were. And the first few months we lost orders based on arguments with them of nope. He'd say, why do you need a hearing? That person's already on an order. Yep, they are. And we want to continue it. So could you just get us that? We're just asking for this. I mean, nothing's changed on our end, but you know, because it changed on their end, and they don't have a system of education for AOTs. They don't. Our prosecuting attorney relies on us for information. And now all of the lawyers in our docket, they come to us if they have a question. I mean, I get random questions about everything from guardianship to power of attorney to, is this good? Should this person, you know, defer? All kinds of things. As we know, probate courts don't give advice on anything. So you can't ask them questions about what form, if a form's wrong, if you fill out a form wrong, even putting the wrong date or the wrong, like transfer some numbers, they won't even, a lot of times it's an argument to try to get them to tell you what you did wrong with the form. Just tell me what I did wrong and we'll fix it. No, just look at it. They'll say, just look at the form, just look at it, kind of figure it out. So we play a little hide and seek game with them sometimes. Our relationship, I see there's a lot of barriers with the court system, and I think it's mostly red tape. I think that's been our barrier to get to our judge right now. There's a lot of, and I'm going to just say it, a lot of egos and a lot of issues with that, where people don't want to step aside and just participate in a bigger plan with us. People work in silos. So the court's working in a silo, we're working in a silo, you know, the other departments are working in a silo, like the prosecuting attorney. And until we started really getting involved with the grant, actually, is when we started to be able to pull more of the system together. But we've got a long way to go. But to get to our judge, you can't just go to her clerk. They block that. If we go to the supervisors over the clerk, they'll tell us, send us your questions, and we'll get to the judge, and we'll determine if it's a question we should send to the judge. And so there is just no direct path to her at this point. As for law enforcement, I can tell you from my experience over the years, I've seen some growth and I've seen no growth at all. And I think it just depends on what police department you're working with. One system is a little more friendly than the other. Can't explain why that is, but it just is. We have more luck with our Ypsilanti or our Pittsfield Township Police than we do Ann Arbor. I've had Ann Arbor Police tell me that they are not coming back because we've had week after week pickup orders for somebody who won't get a weekly injection. And they have told me to my face, we're not coming back next week. Don't call us. And I'm like, okay, see you next week. We'll see you next week because it's a warrant and you're coming back. So we'll see you then. So it's, you know, you're always feeling like you're fighting somebody to get the best services for your consumer, but it's kind of what things are at right now. So we are hopeful that some of these barriers are coming down and we're kind of bringing our system back together, but I still see that we have a lot of work to do.
And
Gotcha,
if it
thank you.
helps, believe it or not, despite all of that, I still love my job. Sometimes the fight is a little masochistic on my part, but I do enjoy doing it. And it's great when things go well, right? It's great to see things kind of flow. And on those weeks are just, those are good weeks.
Yeah.
Well, and I think there's a disconnect within our system as well, within our agency, because you have to think of all the different factors. There's lack of resources. And I think one of the biggest problems we have, and a lot of places have the same problem, is the revolving door issue. where you have new staff that are coming in constantly. It's hard to keep those people trained. It's hard to keep them up to date with where things are at with AOTs. I think the way that people look at AOTs needs to change, and Stacey and I are working very hard on that. And Stacey, you're doing a great job, by the way, being a gatekeeper. It's not a fun job, I know, to have to tell somebody, yeah, no, we're not just going to get you a pickup order because you want to have one on hand. That's what's going to happen. Or if you don't see the client for 6 months and they've missed every appointment between then and now, no, we're not going to pick up order so you can continue your order. You're going to have to go do an outreach. You're going to have to go see your client. That's what you're going to have to do, because it's not a weapon. It's not a punishment. It's supposed to be a therapeutic tool. And not everybody understands that. And it's really hard to get that across when you have people that are not going to be there very long, or they leave. Different ideologies and philosophies also get in the way. But I think that's been one of our biggest problems lately, is people's idea of what the AOTs are and what they should be used for. I think that's a big shift. We used to have an AOT quote step down team. And so that team had all the consumers that had AOTs, or if they were somebody, for instance, that was coming out of ACT and weren't quite ready to go back to adult MI, they would transition them through that program. And if they weren't doing well, they'd stay there and get intensive services. And if they needed to go back to ACT, they did. If they didn't, they'd go to adult MI. I'm not absolutely sure why that went away. Thoughts are that we moved to kind of a managed care arena, and that might have been part of it. We moved to clinic models, and so that wasn't really clinic oriented to have just that separate silo of a team. I know it added a lot of work onto the case managers on the adult MI teams, because you have those consumers that you have to be very, aware of what's going on with them, extra appointments, all that stuff, on caseloads that you have of 100. So I think somewhere in there, things got lost in translation, and we're fighting to get back to get everybody educated and to truly use them as they're supposed to be.
Gotcha. Thank you. Yeah, thank you for sharing. So I did have a couple more questions that I wanted to ask, but this conversation is so robust. I have a feeling that if I keep talking and if I keep asking questions, then we might get to the end of the hour. So I wanted to just quickly open it up. Does anybody have any questions that they'd like to ask, or maybe share a similar experience that you've had in your county, or maybe an experience that's the complete opposite?
Yeah, I've
No?
just got to come, if that's okay, and jump in.
Yeah, of course.
Yeah, Stephanie, I'm with Macomb County. I'm the court liaison for Macomb, and I've had to deal with Washtenaw County judges here and there with some of our cases going through CARO and stuff like that. And I will say, every once in a while, I get a really goofy order from them.
Right?
And it's a shame you guys have to deal with like not having access to the judges like that. Like I don't want to brag, but like we've always had a good relationship with our judges, probably because I've been there longer than a lot of the judges have. So like when they've come in, I've been able to have meetings with them directly. We've gone out to lunch once in a while, suggested, just to catch up on what's going on. So it's a shame that your court works that way.
It is. And I will tell you this, the discussion doesn't go both ways a lot of times, because I will have this judge email me directly when something's happening that involves her or her court. For instance, there's a consumer, and I know you know who I'm talking about, Stacey, who likes to threaten our judge. There's two of them actually that come to mind, but one in particular is very consistent and very detailed in what she would like to do. And so when that happens, she will start leaving voicemails for the judge and for the probate court. And so they will contact me directly to get a pickup order or to look into what's going on for her. But if I send her an email saying, hey, can we have a meeting? I never hear back.
Yeah, that's a shame. Because in that communication, I think it's extremely important. It goes both ways, and who knows what's getting lost in translation and what important information isn't being relayed. And if there are if there are interruptions in the process, then, this is actually a great transition into one of my questions in, the value of getting everybody together, everybody who have their hands in AOT, getting everyone in the same room, whether that be community collaborative meetings, quarterly meetings, monthly meetings, whatever that is, how valuable that is just to be able to open that line of communication. So I feel like I'm aware of y'all having something like that with your hospitals, but can you speak, or with the in-county hospitals, I believe. So can you speak to the meetings or collaborative meetings that you have set up with the other systems?
Most of the meetings that we have with these systems have been kind of reactive meetings where something's happening that's not going right, and then we're having a meeting. I just had a meeting with one of our hospitals, which I have to be honest, was anticipating it to be a very difficult meeting, and it ended up being fantastic. Got a lot done. New court liaison that is really got kind of voluntold to be in this position and really doesn't want to be in it. So she's not up to speed on things. I was able to send her the toolkit and a lot of information, and we offered our assistance, anything we can do to help them. But things like, trying to get the coordination between the lawyers and the hospitals to do the deferrals, that's gonna probably be the sword I die on at this point, because I'm telling you, it's so different for every hospital. There's no, like we talk about all the time, there's no standardization of any kind. So everybody interprets what needs to happen differently. I mean, I've had to, even our in-county hospitals, I've had to highlight the portions of the mental health code that tell you that we are required to be there as part of a representation team, because doctors will question me. Well, other counties don't do it this way. Okay, great. Here you go. Here's a mental health code. I can't speak to why other systems don't do it like this, but we'll talk about us, and here's how we're going to do it. So it doesn't matter if it's in county or out county, we're still fighting the same battle.
Yeah. And that's consistent. That seems to be consistent all across the state, whether it's, not being aware of who's responsible of inviting everyone, or, I just heard something where, there was an issue with more than one CMH representative, being at the deferral conference, and that was an issue for the attorney. And it's like, there's always something. So, yeah, it's tricky business. I wanted to also ask, we've been talking about barriers and things, for a bit here, and I wanted to also highlight some of the cool successes I think that y'all experience and y'all are a part of as well. I know that y'all utilize your mobile response teams in an amazing way. So is there anything you can speak to with how you do that and the process of that?
I'm hoping Melissa's going to be here, but I don't see her on the meeting. So actually that's really exciting, because our crisis team and our AOT process kind of went hand in hand in how they developed. Originally we had, back in the day, one liaison who handled everything. She was pretty amazing, to be honest. And that developed into, as her role kind of dissipated, they developed into kind of a crisis team, not the crisis team we have now, but kind of the budding portion of the process. And then to where we are now, where we have crisis response teams that they've come in and spoken to everybody here, where we have the police and a social worker going out in certain situations. We use the crisis team with kind of twofold. So, because I also supervise our intake department, and so it's actually been really nice to be able to educate them on AOTs and on deferrals and things. So when they get people coming in the front door, they know what the expectations are. And that was not the way it was before I started working with them. They didn't have a lot of education in that department on how to locate the provider if they're on a deferral, and make sure that they get what they need in writing, so we know if we're going to be on the orders, things like that. If somebody comes and they're set up for an intake appointment and they don't show up and they're on a deferral or a full order, we will not automatically get a pickup order. I mean, there are some situations obviously that we will, but as a rule of thumb, we will work with the crisis team get them the information. They will do some outreaches, some phone calls, whatever needs to be done to kind of vet the client out, see if it's just an issue. You know, sometimes it's transportation, who knows what's going on. They overslept. They didn't come to an appointment for that. We don't want to punish them automatically by picking them up and dragging them to the hospital. We need to do a little work there and figure out what's actually happening. So they will, you know, do all of that work. And in the end, if they feel like, yep, this person needs to be evaluated further, they'll either reach out to Stacey or they will themselves go to the court and ask for a pickup order. As well as people getting out of the hospital. On the other end of my teams are my liaisons, who will then contact the crisis team and make sure they're aware this person's getting out. They'll set up wellness calls or, you know, visits, things like that. If that person needs a hotel, the crisis team can authorize that. So we work very, very closely with the crisis team.
That's wonderful. Something also that I learned that y'all do when we first met that I thought was so cool and I hadn't heard it anywhere else is that y'all utilize some local pharmacies to administer LAIs.
Right.
So I think so how did that I have so many questions. Like how did that
it
start? Yeah.
Asking the question if they could do it. I think it's in their formulary to be able to do it anyway. We use it a lot when we can, or we try to, because there's a process that has to happen where the treating psychiatrist has to contact the pharmacy, and there's a process they go through where they fill out an application and it goes through so the pharmacy is Genoa, so it goes through their legal team, and then the contract's written up. We highly push and encourage the psychiatrists to do this, because at any time it's not ending, so they could fill it out today, and in 6 months, if they have somebody leaving that we can't get in to see a psychiatrist in a timely fashion, but needs an injection, then they can call that into the pharmacy, and the pharmacy is absolutely willing to give that injection as long as the consumer is willing. We also have a contract with HVA that we don't use frequently, but we can, that if we have a consumer that needs an injection and they're willing to do it, we can ask HVA and they will give it to them. We used to have a system where we went to psych emergency a lot. We used to be able to pick up clients and take them to either U of M or to St. Joe's and have them get an injection. But those days are over for the most part. I mean, I could say it doesn't ever happen, but as a rule of thumb, it doesn't, because they are very, very busy themselves. And they don't want you just bringing a client up there to receive outpatient services. So that's changed dramatically.
Gotcha. This might just be me, so apologies if it is, but what does HDA stand for?
HDA, it's Huron Valley Ambulance. It's our EMS services.
Okay. Oh, Huron Valley. Okay, gotcha. Okay, wonderful. That's great. Okay, well, those are all my questions. Thank you so much for answering. You all are doing such amazing work, and seemingly with so many moving parts and so many times when it feels like the deck is stacked against you and against all of us, I just appreciate it. I appreciate you being here, and thank you so much for sharing. And is there anything else that you'd like to share before we move on, I guess, to our official Q&A for like the last 10 minutes?
I would just like to say thank you to you guys in general for all the help you've given us. I think that it's been instrumental in where we are right now, even a year from where we were a year ago. So thank you so much for everything you've been helping us with.
Of course. It's our pleasure.
I would say I am very grateful that you guys were there that day that that I got beat up in court. It made me feel better that I was like, yeah, well, these people are here and they are witnessing what you're doing
Somebody
to
can
me.
see.
Yeah, I
Mhm.
was grateful, because otherwise it would have just been me saying this was awful. So
Yeah.
I was grateful for that.
Yeah.
Some validation.
Exactly. Our presence in itself was validation. Like, we saw that. That wasn't cool.
It was hard to
Talk to us
miss.
about it. Yeah.
It was hard to miss, really.
Wonderful. Well, yeah, so for the last 9 minutes or so, I wanted to open it up again, kind of as I was saying before, do we have any questions for Washtenaw and maybe how they navigated certain things, barriers that they had experienced? Are you experiencing any barriers yourself that we can just bring to this conversation here and talk about as a group, as a collaborative group? Do you have any similar experiences? I'll stop talking now. Anything on anyone's mind?
Everybody's like, it's the holiday weekend. We want to go.
I feel that.
Yes, it's going to be a nice weekend for whittling.
I do have a quick question I could probably ask if that's okay.
Please.
Just curious. So for I believe it was Stacey, when you were describing, I guess navigating just barriers with the probate court, and you mentioned the attorneys that you were more or less not getting a whole lot of information as far as what things they were saying no to, that prevented any of these plans to follow through. Were these guardian ad litem representatives or attorneys representing a particular client?
Those were the attorneys. It was different things that were brought up, and I did forget to mention the latest one is that we serve people Tuesday, Wednesday, Thursday, and we have one lawyer that likes to, she frankly told me, well, I only use this excuse when there's nothing else. When I've got nothing else, this is what I'm going to throw at the wall. I'm like, oh, great.
She did. She
So,
said it.
yeah, she told me that. So she will bring up, well, technically Thursday doesn't give 7 days before court. So technically I want to strike to throw out the petition based on that. And none of the other lawyers do that. And as far as I know, they've been served on Tuesday, Wednesday, Thursday forever. So, things like that, and the guardians, if I can't get a hold of them, if I can't, this one lawyer will, she will hunt them down morning, noon, and night, until she gets a hold of them. But I don't have that kind of time. So she'll use that against me, things like that. So yeah, I
Our
love
judge
this.
has caught on to that though a little bit, so she hasn't been just dismissing them as much as she was before.
I love the Thursday thing. That's been my new favorite. When she brings that up, I just kind of laugh. And I'm like, you got nothing else. Good luck.
Hey, I have one comment here in Northeast Michigan Community Mental Health. One of the things, talking about some of the different attitudes and beliefs of the case managers and some of the issues with how uncomfortable it is for our case managers fill out the petitions and testify. And it's not a comfortable part of our job. It's not something that any of us are trained in. So I've really emphasized that, this is part of due process, right, for the patient, that it's in the patient's best interest for them to get as rigorous a representation as anybody else would have, even without a mental illness. And so making sure that they deserve to have the representation, it's our job to, the burden of proof is on us. That's part of our democracy here in the US. And so we do have to show that. And I think we've done some training for our case managers. Specifically, I've done training for the testifying. What are you going to be asked? Why are you going to be asked it? And I think that really helped. Everybody's still a little anxious, when you go before the court, but just anticipating that it is the lawyer's job to make it seem that we did not do our job. So, let's go in there with the information that we need to show that we did. And I think that helps a little bit too when we think about it as them being, sort of advocating for our patients and part of due process, as opposed to feeling like we're being, torn apart for no reason. And I think it helps a lot of people so that they don't walk away feeling like they you know, they were treated badly or, you know, just what an awful experience it can be. So,
I've had conversations with one of our toughest lawyer. This was some time ago where I sat him down and we had a long discussion about things because I was feeling that level of frustration with him that will you do anything for this consumer, even if you know it's not in their best interest? And he said, my job isn't to do what's in their best interest. My job is to do what they want. So if they don't want the court order, that's my job. He said, you do your job very well. I do my job very well. But my job is to advocate for what they want. And so I would tell him, if you tell this client who has a history of getting on planes and threatened to bring anthrax and bomb them and stuff like that, maybe if you told her to come get her shot, she'd come in. And he'd say, yep, she would, but I'm not going to do it because then I can't win my case. So you learn fast, like you're saying, that they're doing their job. This is their job, is to represent the consumer. I think in the case with Stacey, this particular lawyer that she's speaking of goes above and beyond to find things that I feel put arbitrary barriers up, including the way she handles business in general, contacting us and not going through channels to get paperwork that she doesn't want to get through medical records. And so I question how she handles cases in general.
Yeah, I do try to remind myself, they're trying to get them off the order. We're trying to keep them on the order. Just, we are fighting each other. But yeah, it is that there is always that question with certain lawyers. It's like, how arbitrary are you being about, Stacey didn't dot an I, so we should throw out the petition. And it can be a little combative, but I do try to keep that in mind.
Well, it's not consistent either because it wasn't going on this way before with Daniel. It didn't go that way. And it changed when Stacey came on how things got handled, that there are things that weren't being handled that way that are now being handled in a different way. So I mean, that could be because there was a new clerk. That could just be because Stacey answered a question differently than Daniel did, and now they're running with it. I mean, there's a lot of reasons it could be happening, but they definitely go out of their way to try to stop her every chance they can.
Yeah, I do think that's a big part of it, is that they will ask me things that once I answer in a way that was different than the previous person, I'm giving them an in. So I've had to navigate trying to, figure out how he said it, what he said, to get them to stop using those things as a way in, because he had been in the position for 7 years. So me coming in fresh, they're like, yeah, we got her. So I've had to figure out, it's a hard system. It's hard to navigate. So it's a learning process for sure.
Well, thank you. Thank you all so much for coming, especially, before the long weekend and participating in this robust discussion. And I knew this would be exactly like this because, Washtenaw, you're doing such great, amazing work. And just like everyone, in this space. And I just knew that really great, fruitful conversation would come out of this. So thank you so much. We'll go ahead and end it here. If you have any questions, feedback, or inquiries, feel free to reach out to me always. But otherwise, everyone have an amazing weekend.